3, go.
Ladies and gentlemen, it's really a great pleasure and honor indeed for me to be here on the occasion of World Hypertension Day. The theme of World Hypertension Day by World Hypertension League is measure, control and live a life. The most important component is number one, measure blood pressure. We all should measure our blood pressure regularly, periodically, so that we don't fall victim to the hypertension inflicted morbidity. As we all know, uncontrolled hypertension and resistant hypertension prevalence is very high in India because of lack of awareness and lack of adherence and compliance to the drugs. Home BP monitoring has a tremendous role. We all, after the age of 50, should have a home BP monitoring at least once a day every morning. The second important message, if you have a high blood pressure, not responding adequately to drugs, or there is significant variability of the blood pressure, please have ambulatory BP monitoring. Ambulatory BP monitoring is a very, very important tool to know whether you get reverse dipper, non-dipper, persistent time elevation, morning surge, evening surge. You have complete information and you can titrate your drugs accordingly. So the need of measurement of blood pressure cannot be overemphasized. Everybody should know his or her blood pressure at least at the age of 20, and subsequently, if you are hypertensive, follow the instructions of the doctor and please measure your blood pressure periodically. The second important component is control. Control of blood pressure is the need of the hour. If you ask my personal opinion, BP should be controlled up to a level of 130 by 80 millimeter of mercury. If at any point of time it is higher, then the event rate is higher. Maybe heart attack, or brain attack, or leg attack, or eye attack, or abdominal attack, all happen when the blood pressure control is not there. Uncontrolled hypertension is very high in Indians. Resistant hypertension is very high in Indians. So we need to control. Control is the need of the hour. And the control can be done if we have a better adherence and better compliance. And if possible, if one advises a fixed dose combination, or so-called polypharmacy or a polypill in the form of a drug which contains diuretic like chlorthalidone, or a drug like amlodipine or telmisartan. This combination is a fixed dose combination. It will definitely improve adherence and definitely improve compliance. So far the beta blocker is concerned, it should be on the choice of a doctor, because we have to titrate the dose of beta blocker. Whether you do bisoprolol or you give metoprolol, the drug has to be optimized accordingly. The third, live a life. If you control your blood pressure very well and measure your blood pressure very well, you will have a longevity to your life. You will live long without a stroke, without coronary syndrome, without heart failure, without CKD, without peripheral vascular disease. Hypertension may act as a global tsunami if uncontrolled and if resistant, if not taken care of. So the need of control of blood pressure and the need of control of resistant hypertension cannot be overemphasized. A time has come where to introspect, lifestyle optimization, reduction of salt intake, stress management, regular exercise, not sedentary life, no pot belly please, no tobacco, no smoking, reduce alcohol and have a diet control. Once you reduce trans fats and saturated fats and take more of fresh fruits and vegetables and nuts and omega-3 fatty acids, you will have a good time. I must give in last to conclude, act locally, focally, vocally and globally. When you act locally, you can impact globally, and it may help us in reducing the hypertension, infected morbidity and mortality. Thank you very much once again, and I'm sure we are justified in giving the message on all the three components: measure, control, and live a life.